Hello, everyone. I'm Dr. Debulina Mukherjee, and welcome to the fifth episode of Epilepsy Voices of India by the Indian Epilepsy Association. We know that epilepsy treatment has come a long way. So, in this episode, we will focus on the advancements in management of epilepsy, particularly the surgical aspects. And to do that, we have the honor of having with us Professor Malla Bhaskara Rao, sir. Sir is the current president of the Indian Epilepsy Society. He is a senior consultant and head of the Department of Neurosurgery at MS Ramaiah Medical College and Memorial Hospitals, Bengaluru. He was also a former professor and head at the Department of Neurosurgery, NIMHANS, Bengaluru, as well as a former additional professor at Sri Chitra, Thiruvananthapuram. Thank you so much, sir, for joining us today.
Thanks, Debulina. I'm grateful to the leadership of the Indian Epilepsy Association for giving me an opportunity to speak on epilepsy surgery on the important occasion of International Epilepsy Day, which is being uh, celebrated worldwide on the second Monday of every February. And this year it happens to be on February 9th. At the outset, let me reassure all the people with epilepsy, their families, their caregivers, and their physicians that epilepsy is curable and controllable to a large extent. Medicines will help nearly two-thirds of the people, and surgery plays an important role in curing or controlling epilepsy in the remaining one-third. I'll be happy to answer few questions in this regard. Thank you.
Thank you, sir. So let us start with the question and answer session. To begin with, sir, can you give us an overview of epilepsy surgeries?
So, by definition, surgery for epilepsy is a procedure which is being performed to cure or control epilepsy. This is not a new development. In 1860s, epilepsy surgery started in London, United Kingdom. Later, subsequently, following the First World War, due to a large number of soldiers sustaining head injury and then subsequently developing epilepsy, again, there was a resurgence of interest in epilepsy surgery, and this time it started at the Montreal Neurological Institute, Montreal in Canada. The pioneering neurosurgeons of India, Professor Jacob Chandy and Professor B. Ramamurthy, both from CMC Vellore as well as from the Institute of Neurology, Madras, they initiated epilepsy surgery in India in 1950s and performed a large number of procedures, both at Vellore and in Chennai. And of course, in 70s, a lot of new medications have come, carbamazepine and phenytoin. And then there was a decline in epilepsy surgery all over the world, including in India. Again, in 1990s, there is a resurgence of interest. And this time, epilepsy surgery became technology intensive and national institutions have taken a lead, like Sri Chitra Tirunal Institute in Thiruvananthapuram, All India Institute in New Delhi, and National Institute of Mental Health and Neurosciences in Bangalore. I had a historical opportunity to perform first hippocampal resection in India following the advent of MRI in 1995 at Sri Chitra Tirunal Institute, along with my senior neurologist colleague, Professor K. Radhakrishnan. Subsequently, I went on doing more than 1,000 epilepsy surgery procedures, not only at Sri Chitra, but like-minded people went and assisted many young people to develop epilepsy surgery programs at various parts of India. Now, over the last 30 years, 15,000 epilepsy surgery procedures have been performed across 50 to 60 centers all over the country. And then more and more young people are taking epilepsy surgery as a career.
So, who are actually the appropriate surgical candidates?
So to give you a background, we have approximately 10 million people with epilepsy in India. About 6 to 7 million people are likely to respond to uh, anti-seizure medication. Initially one drug, and later in a minority, we may have to add a second or third drug. So we are left with 3 million people who do not respond to medication. And among them, nearly a million are potential surgical candidates. So, who are these 1 million people? They're hidden in the community. It's not very easy to identify them. So, what clinicians we follow is something like a rule of twos. Somebody who has got epilepsy, which is not controlled with medications for more than 2 years, somebody's epilepsy is not controlled by more than two drugs, and somebody who has got more than two seizures per month. These are the people who have to question why their epilepsy is not controlled. They should ask their physicians, their family doctors, that my epilepsy is not controlled. Please send me to a neurologist, a comprehensive epilepsy care center in India, where I'll be evaluated in detail to find out why I'm not getting control with this medication. So they are the people who should reach these comprehensive epilepsy care programs. Now, in comprehensive epilepsy care programs, uh, number of things are done. First, whether they really have epilepsy or not is identified. Sometimes, because of emotional and psychological reasons, some people may have events which look like seizures, but actually they are non-epileptic seizures. They're like a psychogenic seizures. And sometimes the correct type of epilepsy, correct type of medicine may not be identified at local level. So, in these comprehensive epilepsy care centers, detailed evaluation will be done, and then the correct medicine for the correct type of epilepsy will be suggested. And also, there are a lot of lifestyle modifications. For example, doing exercise on a daily basis, eating well, sleeping well, and controlling stress, avoiding the precipitating factors, including stress and emotional factors. All these things will be identified and will be suggested to people how to control, how to manage their epilepsy. And beyond that, if seizures are still persisting, then a detailed workup will be done to identify what is actually causing epilepsy in that particular given person. Is there any structural abnormality in the brain, or is there any electrophysiological focus which is causing epilepsy, and can it be removed? Can the epilepsy will be cured or controlled without any loss of function? For example, vision, speech, walking, talking, hand movement, leg movement. None of these things should be affected by doing such a procedure. So this work will be done by a procedure called pre-surgical evaluation.
Right, sir. So, can you tell us a little bit more about the pre-surgical evaluation techniques and about the surgical procedures also?
So the cornerstone of pre-surgical evaluation to identify this fits from which part of the brain they are starting. Families nowadays, everyone has got access to cellular cell phone, so they can record the beginning part of seizure. This gives an idea from which part of the brain, from the front, from the side, or from the back of the head, the seizures are starting from the right side, from the left side. By looking at the face, the hands, the legs, especially in the beginning, one will be able to identify from which part of the brain the seizures are starting. It should be consistent in all seizures. It should be similar pattern. This pattern recognition is by clinical assessment. That is the most important part. And then the in this comprehensive epilepsy centers, easy is done. Easy is to know the electrical activity of the brain, electroencephalography, and subsequently the easy is to identify the focus, electrophysiological focus, and then MRI is being done to identify if there's any structural abnormality. Is there any lesion which happened during by birth, by congenital defects, or subsequently developed because of any birth trauma, any head injury, brain infection, or is there any tumor? All those things will be identified by MRI. And then neuropsychological evaluation is being done. This is to identify whether all parts of the brain, they're like intelligence, like memory, we see and remember, we hear and remember, all those things, whether they are intact and functioning normally, or is there any deficit. For example, some people may say that they are not able to remember certain words, or some people say that they are not able to remember certain visual input. All these things will be identified, and then they will be correlated. The clinical, for example, if the clinical features suggest that the epilepsy is starting from the left side of the brain, from the close to the ear, or in the front side of the brain, and if EEG shows a electrophysiological focus in the same area, and if MRI shows a structural lesion in the same area, and if neuropsychology shows that that area which was identified by clinical, electrical, and imaging features, if it is not working, then they are the suitable candidates for surgery. Some patients, things are not very clear. In those patients, additional investigations are being done. One such investigation is doing a PET scan. PET scan is to study the function of the brain. MRI is to study the structure of the brain, and PET scan is to study the metabolism of the brain. And similarly, EEG will record the electrical activity of the brain. Similarly, there is a magnetoencephalography which will record the magnetic potentials of the brain. This facility is very labor intensive, and it's available only at two places in India, the magnetoencephalography. One is at NIMHANS, Bangalore. Second one is at in New Delhi, with at the Brain Research Center at Manesar, as well as with AIMS, New Delhi. Still, there are few patients where the so-called non-invasive evaluation, which I have mentioned so far, will not be able to identify the exact structure and structural lesion, and then electrophysiological focus. In those patients, sometimes we may have to put electrodes into suspected areas of the brain which are giving rise to seizures. That is known as invasive evaluation. And one important development in that field is doing stereo electroencephalography. This is precise placement of electrodes in the hypothetical areas which are giving rise to seizures to confirm. Once we have evidence, then we can subsequently subject them to surgical procedures. And regarding the types of surgical procedures, grossly, there are three types of epilepsy surgery procedures. One is known as resection. If there is a part of the brain, small part of the brain, which is developed in an abnormal way or damaged during birth or because of meningitis, encephalitis, head injury, tumor, and if it has got no function, that part is removed. That is known as resective surgeries. Resective surgeries are based on the underlying substrate, and the outcome is good. The next group of surgeries are known as disconnective surgeries. See, children who develop meningitis and encephalitis can have multifocal epilepsy. Multiple parts of the brain, right side, left side, front, side, back, all parts of their brain is damaged because of the this infection and injuries. So for them, we cannot do resective procedures. So if children are falling very frequently, a number of times every day, and injuring their head and then not able to live an independent life, so we can do certain procedures. One procedure is known as corpus callosotomy. There is a bridge between right side and left side of the brains. So when seizures start on one side and then propagate to the other side, that is the time when child falls down, injuring himself or herself. So we cut the bridge between right and left so that child will not fall, so that it becomes a bit easier for families to take care of those children. Similarly, when during uh, um, birth injuries, especially when there is a decreased oxygen and glucose supply to the brain, the posterior part of the brain often used to gets damaged. So for them, we can disconnect that part which is damaged so that the rest of the brain will function better. Similarly, at times, rarely one entire half of the brain can be diseased or damaged. So for them also, we can disconnect that bad brain from the good brain so that the good brain will function better. So this is the second type, which is known as disconnection. The last type of procedure is called neuromodulation. So these are the candidates where we cannot remove any part of the brain. We cannot disconnect also because it's not clear from where the seizures are starting and spreading. For them, various types of neuromodulation procedures available. To name a few, there is one procedure called Wegener stimulator, another procedure called deep brain stimulator, another procedure called responsive neuro stimulator. So, entire full spectrum of all these neurosurgical interventions, resection, disconnection, and neuromodulation, fortunately, are being done in a majority of centers in India, except very few. For example, responsive neurostimulation is available in the United States at present, and hopefully in future the responsive neurostimulation as well as laser interstitial thermal procedures. All these procedures hopefully will be available for people with epilepsy in India. But for the time being, majority of the procedures are available in majority of the centers. Thank you.
Right, sir. So, what are the risks and complications that are associated with these procedures that we should be aware of?
So, epilepsy surgery in selected patients, it is curative or it will control epilepsy in a vast majority of patients. Like something like 60 to 80% of the patients will be cured or their epilepsy will get controlled. Unfortunately, a lot of people either they underutilize the facility or they come very late in the disease, largely because they're not aware, they're afraid of the risks and complications, and some people say that they cannot afford. So let me assure you that by and large, epilepsy surgery is a very safe procedure. A lot of progress happened in in pre-surgical evaluation. Our understanding of the surgically remediable lesional epilepsy syndromes in the identification of the lesion and focus, especially with MRI and video EEG telemetry, radiology, a lot of progress in radiology, and a lot of progress happened in the field of neuroanesthesia, and a lot of progress happened in the field of neurorehabilitation, and also in epilepsy surgical techniques. So most of the patients, almost like 95 to 99% of the patients will go through epilepsy surgery procedures without any complications. Of course, any neurosurgical intervention, there is a less than a 1% risk of mortality, and less than 5% risk of morbidity, which can be bleeding, infection, focal neurological deficits, and whatever happens in the mainstream neurosurgery is applicable to epilepsy surgery also. Of course, these things are discussed in great detail in the pre-surgical following pre-surgical evaluation, the patient management conference. A team of doctors from multiple specialties will sit, discuss about all these things, and if a procedure is going to benefit the patient without much risk, then only it is offered. And of course, all these things will be clarified in great detail during obtaining the consent also.
So, can you also tell us about the recovery process and the overall outcome?
So the wound healing time in human body is 3 weeks. Any wound, including the surgical wound, has to heal in 3 weeks time. Of course, there can be variation in very small babies, as well as very elderly people, or people who are immunocompromised, people who are on steroids, or because of the faulty surgical technique. Sometimes the wound healing can be impaired, but usually people recover in 3 weeks time. Of course, the hospital stay is only for 1 week, and subsequently they should take rest to recuperate at homes for another couple of weeks. And after 3 weeks, they can attend to their day-to-day activities, even can move out of the house also. But full healing, wound healing from surgery takes at least a minimum of 3 months. So after 3 months, they can resume their regular job, including travel or a distance, and then even 6 months later, even contact sports are also permitted for young and adolescent people.
Sir, what about the anti-seizure medications?
So usually people wait for 20 years before undergoing epilepsy surgery. So the day epilepsy surgery is being done, the next day people should not stop the drugs, because their brains were affected by epilepsy for almost more than 1 or 2 decades. So there'll be other areas of brain with irritation and irritable foci. It takes time for brain to heal. So drug reduction has to be done very gradually over a period of time, or a period of several years. The drug which is least effective, last started, more expensive, more side effects, usually we stop it for the first time. And then the remaining drugs, gradually, one by one, we reduce over a period of many years. In India, there are studies from Sri Chitra and other institutions that in adults, nearly 30% of people after surgery, we can taper and stop the drugs. Whereas in children, nearly 50%, we can taper and stop the drugs for a period of time. This drug tapering is best done by the primary treating neurologist or the patient, because neurologist has been following the patients for many years before surgery, and they're in a better position to gradually reduce and stop the drugs for a period of time.
Sir, can you also guide us about the prevention strategies?
Of course, we have. I have mentioned that last 30 years, we performed about 15,000 epilepsy surgeries across India, and see, we have a million potential surgical candidates. I believe by mathematical modeling, it takes 200 years to do surgery for all these people. So all of us have to pay attention to how to prevent epilepsy, and then even avoid epilepsy surgery. For example, the head injuries. Uh, every 4 minutes, one person is dying on the Indian roads because of the head injuries. I believe by 2050, one person will die every minute on Indian roads. And for every accident death, there are potential 1,000 potential accidents uh, will be happening across the country. So we have to take all precautions to prevent road traffic accident, head injuries, and infections. At one time, neurocysticercosis is very prevalent across many parts of India. Fortunately, now the incidence is coming down. So this is common among people who eat salads and undercooked pork. So hygiene plays a great deal in preventing brain infections. We have to prevent infections, we have to prevent head injuries, and um, at one time, home deliveries were very common in rural India. And if there's a cord around the neck, and if child sustains hypoxic ischemic brain damage, subsequently the child was vulnerable to develop epilepsy. So fortunately, now most of the deliveries are hospitalized deliveries, and I believe in some states of India, this is like a mandatory rule that there should not be any home delivery. And I hope it becomes a norm across India, so that these injuries related to home delivery will not happen. And also, of course, a lot of lifestyle changes. You see, young people, they're awake whole night watching videos, movies, and then playing video games, and then watching cell phone in the late night. All that will cause a lot of irritation to the brain, and then making them vulnerable to develop seizures, and then epilepsy, and then subsequently uncontrollable epilepsy. So lifestyle modifications are very important. People should practice exercise, should eat well, sleep well, and then avoid anything which can provoke or precipitate seizures. So, and then after all these preventions, unfortunately, those who develop epilepsy should uh, identify the problem very early. There's a saying that if problem can be identified early, the management also will be simple and then very effective. And they should reach out to these comprehensive epilepsy care programs early in the course of the disease, so that they can gain maximum out of these developments.
Right, sir. And sir, one final question. How does one go about establishing comprehensive epilepsy care programs, considering the cost factors associated with it?
So, epilepsy, two points in that question. One is how people with epilepsy should reach these centers, and second is how centers can develop. So first is development of the comprehensive epilepsy care programs. There is a need to develop more and more comprehensive epilepsy care programs across India. And historically, after looking at the way things develop at institutions of national importance, and both the public sector and private sector programs, there is a need for a motivated team with a team leader is essential to develop comprehensive epilepsy care programs. Investment in epilepsy surgery programs is more in people than in machines. We just need one video easy telemetry to identify classified seizures and MRI to identify the structural lesions in the brain. MRI is widely available across not only Tier 1 but even Tier 2, Tier 3 cities in India. And video easy telemetry is not very expensive. It is some 15-20 lakh rupees for a machine. Of course, we need more people, more committed people, more dedicated people, more young people should focus on taking care of people with epilepsy. That is from the establishment side. From the patient side, I think patients should look at proximity. Wherever they are located in India, they should identify the uh, center where they can reach easily. It's not a once in a life treatment. They have to make multiple visits prior to surgical intervention and subsequently following surgery also. So they should see the proximity reach of these places. Also, they should look at the team who are working there, their credentials and their expertise, and then the logistics. Of course, they have to look into the financial feasibility also. Of course, we have the surgical services are available in public sector as well as private sector. In public sector, the cost is less because it's highly subsidized by the government bodies. Of course, as expected, there is a longer waiting period, whereas in the private sector, it's a more expensive, but waiting periods are lesser. And so people have to choose based on all these factors. But one very important consideration is surgery cost is a one-time expenditure, whereas medicine cost is lifelong. Throughout the life, they have to spend money, not only paying for the medicine, but also either hospitalizations and then loss of work and very impaired quality. If a person is not able to study, uh, not be able to get a job, will not be able to get married and have a social life. So apart from monetary issues, there are huge implications regarding the quality of life. Of course, unfortunately, many people from the lower economic strata are affected by epilepsy. So they should reach out to public sector institutions, and they can take assistance from governmental programs like Ayushman Bharat, or various states in India have got financial assistance uh, for these people, and sometimes even crowd funding the CSR activities of various corporates and individuals with philanthropic goals also will help these people to obtain the surgery. So they should take all opportunities to help themselves.
Thank you, sir. Thank you so much for such a lucid explanation and enlightening us about the tremendous progress in epilepsy surgeries. So, do you have a final message for our viewers?
Uh, uh, if your epilepsy is not controlled with two drugs in 2 years, and if you are having more than 2-3 seizures per month, please ask your doctors why my epilepsy is not controlled. Please refer me to a specialist who will find out, who will study my epilepsy in detail and then suggest suitable treatments, including surgery. Great progress has been made in medical and surgical management and also management of comorbidities, including there's a diet therapy, ketogenic diet. All those things will be provided in comprehensive epilepsy program. So please take advantage. Don't keep on suffering with epilepsy. Epilepsy can be cured or controlled to a large extent. Please help yourself. Thank you. Thank you very much for the opportunity, madam.
Thank you. Thank you, sir, for your guidance and for giving us your valuable time. And thank you also to all our viewers for listening to us today. Do stay tuned for more such informative videos. Thank you.
Thank you. Thank you.